So in terms of urgent unmet medical need areas in myelofibrosis, we unfortunately have many. And so I think that's the call to action for research that we need. And that's why meetings like ASCO, ASH, EHA, and AACR, and the smaller meetings that we do throughout the year are very important. My colleagues and I do discuss and talk about this on a daily, weekly, monthly basis. I also see patients in the clinic, and we're leading all these clinical trials together with our collaborators overseas. I think there are several areas of unmet medical need. One is in the combination therapies that we're actively developing together. How do we minimize toxicity and maximize safety for patients as we add a second, maybe even a third drug at some point into the mix, particularly as we move these treatments to the frontline setting. So that is a very important aspect of what we do in the myelofibrosis field. Number two, how do we adequately measure MPN symptom burden in the setting of these combination therapies? Dr. Ruben Mesa, our friend and colleague, pioneered that in the JAK inhibitor Ruxo era. Now, do those same factors apply in the combination era, or are there different things we need to look at? And then still a third category is disease modification. What does that mean in 2022 when we have new agents beyond JAK-STAT we're combining? So in the JAK era, we used clinical factors such as spleen decrease, patient symptom burden improvement. These were very important endpoints, and that's what led to the approval in the JAK inhibitor class. Now that we have these novel agents, we're trying to look at bone marrow fibrosis reduction, molecular variant allele fraction decrease, overall survival improvement, and then even looking deeper at the molecular level, cytokine level, et cetera. So I think these are the areas of need. How do we understand the responses for the patient and objectively in the new era? How do we measure brand new factors that we have never thought about before? And how do we translate that into a safe program for our patients to be able to do all over the world? So I personally am actively working on that, and my colleagues are as well.